Hi everyone. So for our interprofessional collaboration assignment, we chose to collaborate with a massage therapist. So this presentation is done by myself, Gazelle, Samantha, and Mabuba. We're going to be talking about, first we're going to introduce the massage therapist we collaborated with. Then we did a little preliminary quiz with her. We're going to talk about the comparison of a dental hygiene versus the massage therapist assessment. We're going to talk about techniques of assessing a TMJ issues, types of massages that the massage therapist recommends to clients at home, the referral process for clients at the massage therapist office and if it's covered by insurance, how the dental hygienist performs extra-oral exams, a conclusion, and then references. So this is the massage therapist that we collaborated with. Her name is Candace Power. She works in an office in Strathroy, which is close to our home. She also works from home. She has been practicing as a massage therapist for 4 years. She is registered by the CMTO, the College of Massage Therapists of Ontario. She studied at Fanshawe College in London for 3 years in total. The number of clients she sees in a day depends on the day, but she said it is about an average of 5 to 6 clients. A fun fact about her is that she is also a figure skating coach.
At the beginning of our Zoom meeting, we did a preliminary quiz for her. It was a few questions like on Kahoot, and she did really well. She got 100. And these are some of the questions that we did. You can read them later in your free time. This is the other questions. And now we're doing a comparison between the registered dental hygienist and the RMT during the assessment. So the dental hygiene, as you know, we're checking for the TMJ issues first by checking for popping or clicking. And we ask the client if there is tenderness or pain in that area. And we're checking for maximum comfortable opening. Any deviation from the midline, any malocclusion like a class 2 or class 3. We do interpret the radiographs with the DTS to look for any signs and symptoms for TMJ's issues like tightness in the TMJ. Also, we work intraorally, so we assess for the attrition and the recession that may give us a clue that the client is clenching or grinding, and that will cause TMJ issues. This is one of the things that we do, and the RMT doesn't do. So because she's doing an intraoral massage, we educated her about this, and she can look for the signs and symptoms and give a referral for the DDS if it's present. What she does is like almost similar for what we do. She's doing palpating for the muscles to check for pain and tenderness. She tests for abnormalities that Mahbouba will go over later. She do the test for TMJ range of motion. It's called the 3 knuckles test. We will show you a video about that later as well.
So the registered massage therapist assesses TMJ issues, and I'll be talking about the techniques she uses. So first, she feels for abnormalities, and some of the abnormalities are called hypertonicity bilaterally. And she does this first by placing the client in a supine position and asks the client to use their first 3 phalanges and places them between their incisors if they're able to. If they're not able to perform this test, and if it causes pain, then it's a positive test. She also measures the maximum distance between the teeth in order to have baseline data. And she also assesses the opening of the mouth, and if they're categorized into 2 types, S-curve structure or C-curve functional. So this is an S-curve opening. As you can see here, she's forming that C-curve opening. And then this is the S-curve opening. And this is the 3-knuckle test. As you can see here in the video, he's using his first three phalanges, his first three fingers, and opens really wide and tries to fit those three fingers. And if he does feel pain when he does this, then it's a positive test.
So next, with our Zoom meeting with Candace, we asked her about the different types of massages that she recommends to clients at home. So she talked about how she teaches clients how to do intraoral massages as well as extraoral massages of the muscles of mastication. She also said that she prints off some pictures to give to clients to assist with the form and technique of how to perform these massages at home. And in the pictures below are different types of massages that she shows to her clients. Next, we talked about the referral process for clients at the massage therapist's office and if there is any coverage for massages. So she has a list of professionals when she needs to make a referral. She first asks the client if they already see a professional in which she is thinking of referring the client to, for example, a chiropractor, social worker, or a dentist. If they do not, she would refer clients to the professional that she knows and give them a business card or information of how to reach that professional. And with regards to coverage, so if the clients do have benefits, sometimes it depends on their benefits if they cover 100% or some only cover 80%. So it all depends on the client's benefits. So next we educated Candace on how we perform our extraoral exam. So we basically went over everything that we do on the blue sheet in clinic. So we start with the overall assessment of the face, head, and neck, including the skin. And then to assess the TMJ, we place our finger on the TMJ joint and we ask the client to open and close a few times. And during this, we listen for sounds and assess for pain that the client may have. So in conclusion, we learned a lot about how a registered massage therapist assesses and treats TMJ issues. There are a lot of similarities between the registered massage therapist and our profession, the RDH, as to when we assess TMJ issues. We learned how we can benefit from her knowledge and also learned about the different intraoral and extraoral massages and when to refer clients, possibly to refer clients in the future. So this concludes our presentation. These are our references. If you guys have any questions, please let us know. Thank you.